we've been constantly telling you to not let your guard down. We've been constantly questioning the state authorities wherever we've seen a large number of lockdown violations, wherever we've seen the authorities not implementing rules on ground, people not following rules on ground. And there is a reason why we've been saying that. Simply because the COVID pandemic is not over. We may be unlocking, but the virus hasn't gone away. In fact, we are still discovering things about the virus itself, which is why it is very important for us that the effort we took over the last 3 months when we were in a lockdown, that the effort and the sacrifice that we made for those 3 months when we were completely in a shutdown mode does not go waste. Tonight, I bring to you data as a continuous exercise that we've had here on Mirror Now with the India Outbreak Report in association with Productivity. And this data should send the alarm bells ringing in your own mind, should give you a sense that you cannot let your guard down. This data is reflective of the fact that the minute we open up and we begin to step out of our homes, the cases will go up. Now, to what extent are we all right with that is a big question. If the number of cases, active cases, go out of control, can India's infrastructure, the healthcare system, really take on that kind of a burden? Remember, the battle for us is very different from what it is for any other country in the world because we have that high density population. Now, as I present to you the latest projections as per this India Outbreak Report, let me first tell you what the key headlines are. The projections show a stark rise in cases. The peaking of cases that was earlier around July, first week to end week July, maybe in some cases August, has now gotten further prolonged, further delayed for most parts of the country, which means that there are more and more cases still coming out, and the worst isn't over for a lot of big cities in our country. Not only that, the initial projections about a month ago showed a peak for India around 2.5 lakh cases. That's now jumped and more than doubled as a projection. And that's a big jump that we're going to sit and analyze today with the help of data and our experts. The other big headline is the steep surge in cases that's coming in from the southern states. Yes, the states that were actually doing well in the first part of this lockdown are the ones who are witnessing a worsening of the situation, a big deterioration. And we will get you those breakup numbers. Karnataka, in fact, for example, is projected to now see 53,000 cases by August 4th. Very different from what the situation was just 3 weeks ago in Karnataka. The situation is stabilizing in Delhi, in Mumbai, and in Gujarat. The places where we saw a big challenge last month and the authorities clamped down, rules were strictly followed, are the ones that seem to be seeing an improvement now. Pune and Thane are still the big challenges in Maharashtra, unlike Mumbai. Of course, cannot let our guard down anywhere. Delhi seems to have crossed its peak point, provided, of course, the situation doesn't change drastically because of a third factor. The doubling rate is increasing even now for states like Maharashtra, Rajasthan, West Bengal and Gujarat. So yes, they seem to be doing something right. It's taking more time now for cases to double there. The doubling rate is falling in Telangana, Tamil Nadu, Andhra Pradesh and Karnataka, which means that the cases are doubling there faster. It's not a good sign. These are just the basic overall headlines. We are going to break it down over the next 1 hour, so you stay with me to find out how your state is doing, how your city is doing. First up, I actually want to go across to the man who's actually been heading this exercise, Dhruv Ghosh Dastidar, Director for Data Analytics and Digital Transformation at Productivity India is joining us right now. And Dhruv has been doing this exercise with us for several months now. Dhruv, let's begin with what really caught your eye when you were putting together the data this time versus, our previous exercises that we've done. It's starkly different, but what caught your attention? Dhruva, we seem to have a problem with your audio line. We're just going to fix that and we will come back to you in just 30 seconds. Okay, I believe we've got the audio line through now. Go ahead, Dhruva.
So I am saying that for us, when we looked at the data this time, we saw the effect of unlocking, right? For the last number of reports or waves which we ran, we have seen the effect of lockdown. And we have seen how well it can control the increase in the number of cases. However, this time when we looked at, we saw the effect of unlocking very badly in the southern states. Now, if you look at the northern states versus the southern states right now, you will see that the table has turned. What was the case a couple of months back in the central and the northern part of India is now where the southern states are, and vice versa, right? So that definitely has caught an attention. The other thing which we have seen is the pace at which this can rise when it is when we are in the unlocking period. Take an example of Mumbai and Thane. Mumbai at its peak was 29,000 cases in 1st of July. When I say peak, I mean active cases. Whereas in Thane, we have seen a growth to 30,000 cases within a very short period of time. Same goes for Bangalore, right? It grew from 200 cases to 7,000 cases in a very short span. And that, as you rightly said, puts a strain on our infrastructure. That's something which we have observed. What we have also observed is the states like Uttar Pradesh, Madhya Pradesh, they have started doing much better as compared to last time. What we measure is with the R naught, right? The reproduction number. That has significantly gone down for the northern states. And unfortunately, it has gone up for the southern states. Gujarat, West Bengal, Maharashtra is kind of in the middle. The epicenter keeps on changing from one state to the other as well. So initially, in the early days, it was Bombay and Maharashtra. It moved towards Delhi and then towards Tamil Nadu and Chennai. And somewhere it's in Telangana and Karnataka right now. So that's also a cause of concern for India overall, right? So once one of the states does better, the other states kind of seem to do a little bit worse and starts getting into uh, the rising mode, right? That has been our main concern with this pandemic. Another thing which we have observed is compared to other countries, we tend to keep at the same growth rate for a much longer time. So if you look at the 7-day moving average of our growth rate, we are still around 3.5%, which is not mostly the case with most of the countries. So once you cross a certain recovery, the growth rate falls drastically, which is not the case for India. But still, we see a lot of recovery happening. We see the mortality rate also on the lower side. So that's also something which hasn't changed drastically for India. We were at a lower mortality. We still continue to be there. So these are some of the factors I would say, Tanvi, we have observed from these from the last time we ran the report and this time.
Okay, Dhruva, the other thing, as we bring out this data, what everybody wants to know, obviously, and which is why state-wise and city-wise we are breaking it for them, because everybody wants to know when will it end in my city, when do I get to go out. But the other thing is, how are we faring? Is there one statistic that we can take away as a sign, a positive sign and a ray of hope?
Two things. We are a country where our number of cases by number of tests run is somewhat on the lower side, which means that the positivity ratio is lower as compared to many other countries. So that's a good sign. Our mortality is also a bit on the lower side, which is also good. What we also should look at the recovery rate going up and staying up. What we have observed for a lot of these states and cities which we are monitoring, the recovery rate goes up and then it starts tanking down, which is a problematic area, right? And I would keep a watchful eye on all the states which are now at a very high recovery rate. States like Uttar Pradesh, Madhya Pradesh, and a very low reproduction number. It shouldn't start falling down. If it starts falling down, that should be an early warning signal for us to put a check to that, which didn't happen, unfortunately, in case of the southern states. When the recovery rate started falling and the reproduction number started going up, we should have perhaps put a check there itself. So yes, certain KPIs or certain key parameters needs to be monitored on a regular basis and ensure that we take steps earlier than later so that we can put a check on the disease itself.
Dhruv Dastidar, thank you so much for joining us and putting that in perspective as we now present the data that you and your team have mined for us, and it's so helpful for people, for authorities. Everybody needs to take a note of this, because this is essentially showing the result of how we fight coronavirus, how we conduct ourselves, whether we are following rules or not, whether we're doing enough to crack down to limit the spread of the infection. And this is the data that tells you all of those stories. So let's begin. First up, I actually also want to bring to you the 10 states where the cases are likely to peak first. Now, this is as per the data that the governments put out, the state governments put out, and then we use that in our projection model. And as per that, here are the states who may see peaking than other states. Maharashtra likely to see a peak now by 1st of August. It's changed. It's pushed forward significantly as cases rise in outside Mumbai in districts like Thane, and Pune continues to be a problem. So by August 1st, Maharashtra is likely to peak. Karnataka is the other one. Was doing so well initially, and now its peak date has moved to 8th of August with roughly about 53,000 projected cases. Tamil Nadu is likely to peak sooner than these two states, so say by July 20th, and roughly the same amount of active cases as Karnataka, around 53,000 at that point of time, and then the number of cases are projected to begin to come down. Andhra Pradesh is likely to peak by August 16th with about 34,000 cases. Now remember, viewers, these are active cases. New cases will keep adding, but if the number of recoveries are higher than new cases, that's where after this point your active cases will begin to go down. Then you have Uttar Pradesh, which is likely to peak around August 18th with about 34,000 cases. Delhi, in fact, Delhi has already peaked. So all of those, strict measures that the centre and the Delhi government took, the entire debate and conversation and crackdown that took place in June, as of now, it seems Delhi may have seen its worst already. Now, unless they let their guard down again and cases begin to go up again. Delhi peaked on June 27th. Telangana by July 30th. Gujarat by July 22nd with about 10,000 cases. Kerala by August 10th, so there also it's shifted a little with about 4,300 cases, but the number of cases are still lower. And Haryana has also already peaked, but they cannot let their guard down. So this is as far as the 10 states are concerned. Let's quickly start our conversation with the state of Karnataka. Here on Mirror Now, we've told you again and again in the last 3-4 weeks that something seems to be going wrong with the Bengaluru model and in the state of Karnataka, to the extent that even now the authorities and the government is accepting that yes, suddenly they're looking at a huge spike. These are the big takeaways from the charts that are on your screens right now. The situation has actually worsened from June 14th to now. The peak has now shifted by 42 days, which means, and it's also gone up. It's supposed to peak with about 53,000 cases now. And the R0 rate, viewers, which is how many people can one person infect, which shows the extent and how quickly the infection is taking place, that has gone up in the state of Karnataka from 1.42 to 1.62. So this is also a very important statistic that most experts look at, your rate of infection spread, which is the R0. And as it goes up, it shows a terrible picture.